Introduction. Understanding bipolar disorder. Bipolar disorder is a serious mental illness. It affects millions of people worldwide. This disorder, once known as manic depressive illness, causes extreme shifts in mood, energy, and activity levels. These shifts can make it hard to function in daily life. Imagine a pendulum swinging between two extremes. One side represents mania, a state of intense energy and euphoria, while the other represents depression, a state of profound sadness and hopelessness. Bipolar disorder is like being caught in this constant swing, experiencing dramatic highs and lows that can be debilitating. The impact of bipolar disorder extends beyond the individual. Families and friends often find themselves on an emotional roller coaster, trying to understand and support their loved ones. Despite the challenges, it's important to remember that bipolar disorder is treatable. With proper diagnosis, treatment, and support, individuals with this disorder can live full and meaningful lives.
Decoding the spectrum. Types of bipolar disorder. Bipolar disorder varies in intensity and frequency of mood episodes. It's categorized into different types. Bipolar I involves at least one manic episode. Depressive episodes are common in bipolar I. Bipolar II has hypomanic and depressive episodes. Depressive episodes in bipolar II can be severe. Cyclothymia is a milder form with numerous mood swings. Understanding these types aids in accurate diagnosis and treatment.
Unmasking the extreme symptoms of bipolar disorder. Bipolar disorder manifests through a complex interplay of emotional, behavioral, and physical symptoms. These symptoms can vary significantly from person to person, making it challenging to recognize the disorder. Manic episodes are characterized by an abnormally elevated or irritable mood, accompanied by increased energy and activity levels. Individuals experiencing mania may talk excessively, have racing thoughts, engage in risky behaviors, and have a decreased need for sleep. They may also experience grandiose delusions, believing they have special powers or abilities. Hypomanic episodes share similar characteristics with mania, but are less severe and shorter in duration. While hypomania may initially seem like a period of increased productivity and creativity, it can quickly spiral into full-blown mania or depression. Depressive episodes, on the other hand, are marked by persistent sadness, hopelessness, and loss of interest in activities once enjoyed. Individuals may experience fatigue, changes in appetite or sleep patterns, difficulty concentrating, and thoughts of death or suicide. Recognizing the symptoms of bipolar disorder is crucial for early intervention and treatment. If you or someone you know is experiencing these symptoms, seeking professional help is essential. Exploring the roots, causes, and risk factors. While the exact causes of bipolar disorder remain elusive, research suggests that a complex interplay of genetic, biological, and environmental factors contributes to its development. Genetics play a significant role as bipolar disorder tends to run in families. Individuals with a family history of the disorder are at an increased risk of developing it themselves. However, having a genetic predisposition does not guarantee that someone will develop bipolar disorder. Brain chemistry and structure are also implicated in the disorder. Imbalances in neurotransmitters, the chemical messengers in the brain, are thought to contribute to the mood swings characteristic of bipolar disorder. Environmental factors such as stress, trauma, and substance abuse can trigger or worsen bipolar disorder symptoms. Life events like the death of a loved one, job loss, or relationship problems can also play a role. While it's impossible to eliminate all risk factors, understanding them can help individuals make informed choices about their health and well-being.
Seeking clarity, the diagnosis of bipolar disorder. Diagnosing bipolar disorder is a meticulous process that involves a comprehensive evaluation of an individual's medical history, symptoms, and family history. There is no single test to diagnose bipolar disorder, so mental health professionals rely on a combination of methods to arrive at an accurate diagnosis. A thorough medical history is crucial to rule out other medical conditions that may mimic bipolar disorder symptoms. Conditions like thyroid disorders, sleep disorders, and substance abuse can all present with similar symptoms. A detailed account of the individual's mood episodes, including their frequency, duration, and severity, is essential for diagnosis. Mental health professionals often use standardized questionnaires and mood charts to gather this information. Family history is also taken into consideration, as bipolar disorder tends to run in families. Knowing if close relatives have been diagnosed with the disorder can provide valuable clues. Diagnosis is often a relief for individuals struggling with bipolar disorder. It provides a name for their experiences and opens the door to effective treatment and support.
Navigating treatment, medication, and psychotherapy. Treating bipolar disorder is a multifaceted approach that typically involves a combination of medication and psychotherapy. The goal of treatment is to manage symptoms, reduce the frequency and severity of mood episodes, and improve overall quality of life. Medication plays a crucial role in stabilizing mood and preventing relapses. Mood stabilizers, such as lithium and anticonvulsants, are commonly prescribed to regulate mood swings. Antidepressants may be used to manage depressive episodes, but they must be used cautiously as they can sometimes trigger manic episodes. Psychotherapy, also known as talk therapy, is an essential component of bipolar disorder treatment. Cognitive behavioral therapy, or CBT, helps individuals identify and change negative thought patterns and behaviors that contribute to their mood swings. Interpersonal and social rhythm therapy, or IPSRT, focuses on regulating sleep-wake cycles and daily routines, which can help stabilize mood. Finding the right treatment plan is an individual journey. It often involves trial and error to determine the most effective combination of medication and therapy for each person.
Offering support, helping someone who refuses treatment. Supporting a loved one with bipolar disorder can be both rewarding and challenging, especially if they resist seeking help. It's important to remember that you can't force someone into treatment unless they pose a danger to themselves or others. Education is key. Learn as much as you can about bipolar disorder so you can better understand what your loved one is going through. Share your knowledge in a compassionate and non-judgmental way. Encourage your loved one to seek professional help. Offer to help them find a therapist or psychiatrist and accompany them to appointments if they'd like support. Validate their feelings. Let your loved one know that you hear them, you understand their struggles, and you're there for them. Avoid dismissing or minimizing their experiences. Set boundaries. While it's important to be supportive, you also need to protect your own well-being. Let your loved one know that you're there for them, but you won't tolerate abusive behavior. Remember that you are not alone. Support groups and online resources can provide valuable information, guidance, and a sense of community.
Living well with bipolar disorder. Living with bipolar disorder can be a lifelong journey, but it doesn't have to define a person's life. With proper management, individuals with this disorder can lead fulfilling and meaningful lives. Medication adherence is crucial for managing symptoms and preventing relapses. Individuals should take their medication as prescribed and report any side effects to their doctor. Lifestyle modifications can also make a significant difference. Getting enough sleep, eating a healthy diet, exercising regularly, and managing stress can all help stabilize mood and improve overall well-being. Building a strong support system is essential. Surrounding oneself with supportive friends and family members who understand the challenges of bipolar disorder can provide a sense of belonging and encouragement. Finding purpose and meaning in life is important for everyone, but it can be especially helpful for individuals with bipolar disorder. Engaging in hobbies, pursuing passions, and contributing to the community can provide a sense of accomplishment and fulfillment.
Conclusion: a beacon of hope. Bipolar disorder is a complex and challenging illness, but it's important to remember that hope exists. With proper treatment, support, and self-care, individuals with bipolar disorder can live full and meaningful lives. The journey may be marked by ups and downs, but the human spirit is resilient. By embracing the challenges and celebrating the triumphs, individuals with bipolar disorder can find strength, resilience, and a renewed sense of hope for the future.